Okay, well, here we are, Grenada Matters, with my co-host Earl J. Maitland. Earl, how are we doing?
I'm fine as I can be. How are you, Ingram?
I'm good. Well, I hear some news, some distressing news from Grenada.
Yes, as usual, a pleasant good afternoon to all the persons that are here with us today on Grenada Matters as we discuss ongoing issues in Grenada. Um, Unfortunately, today there is something that concerns the people of Grenada, the dispassionate thinkers in Grenada, who are very concerned with the judicial system. And by saying that, I refer to the courthouses and the laws as they have been implemented and executed by those in authority. Today, we would briefly discuss our concern with a judgment in the case of case number 31 and 32. And for those that are not aware, that is the doctor who came into Grenada with his wife, and they were said to violate the Quarantine Act as persons who tested positive for COVID right here in Grenada. Ingram is with us today, and we do have a short news clip to play for the persons who may not have seen that news clip as yet, before we get into dissecting what has occurred up until that point to know. Ingram, do you have that clip ready and
Let,
available to play for
let's see
our
if we can get
people?
up there for you, my brother. Let's see if we can get it for you.
Okay, thank you.
I think we've got it here. Can you see that? Can you all see that?
Yes, yes, we
Here's
can.
the clip. Let's roll the clip.
Dr. McKinney and his wife were arrested and charged and were represented by attorney as Gill. He arrived in Grenada on November 1st with a negative PCR result. Speaking at this morning's court hearing, Gill indicated to the court that his clients leaving the confines of their home was a genuine mistake. According to Gill, a second test was conducted on November 4th, and on November 6th, the couple inquired about the result as they had an engagement scheduled for that night. A screenshot with a negative result was sent to them at approximately 8:40 p.m., unknowingly that it was an error as the screenshot was that of the first test that was done. Upon receiving the image, the couple proceeded to their social event. Gill went on to tell the court that the couple were later informed that there was a mix-up and the wrong results were sent to them. The couple, according to Gill, had no intentions to breach the quarantine protocols. As being a medical doctor, he is an advocate for the adherence of COVID-19 protocols. In proceeding to sentencing the couple, Magistrate Teddy St. Louis indicated that he has to set a precedence so that potential violators will think twice about their decision, and as such, instructed that a $10,000 fine be paid forthwith, $5,000 each. The fines were paid and they were subsequently released. Among the considerations for the sentencing were that they had no previous convictions and they both pleaded guilty, which afforded them a one-third reduction in their sentence. Dr. McKinney is a St. George's University alumni whose reason for visiting Grenada was to continue discussions for the opening of a women hospital here. According to him, the lands were already secured for the project, and the initiative is his way of giving back to Grenada for the opportunity he had to study at the university. Reporting for MTV News, I am Tonya St. Louis Lawrence.
Now, and that clip came to us compliments MTV Grenada, one of the local media stations. It is very disturbing in the sense that persons were able to enter Grenada, the borders of Grenada, and despite the fact that COVID continues to be a rampant pandemic for all countries around the world, the Ministry of Health Grenada saw it fit with their experts and their expertise to limit, to shorten the time period for quarantine. They moved it from 14 days to 4 days. Now, in addition to that detrimental fact that can affect the lives and the livelihoods of all persons living in Grenada, persons are able to quarantine themselves. And that comes in with the home quarantine. Although this is a pandemic that has taken many lives, persons are allowed to home quarantine. Now, based on what we have experienced and based on my personal experience on returning to Grenada the first week in August, after presenting information, contact number, place where I would be staying, and so forth, I was allowed to go home and quarantine for a 14-day period. Now, many persons do not have that empathy that we always speak of. Many persons do not have that reason and ability that we speak of. So we have many persons who I am sure the ministry is aware that would be lawbreakers. They would violate the laws. And one of the reasons that I know this is because we do have a prison, we do have a detention center for persons who violate such laws. We have courts which fine persons and so on for violating basically the laws of Grenada. So we are aware that individuals would act in their own mental capacity and decide if they would follow a procedure or not. Um, Persons have been allowed to go home unmonitored and be quarantined, right? To quarantine themselves. In addition to that, after listening to this news clip, what we found out was that a medical doctor and his wife were able to enter Grenada, placed on a 4-day quarantine period, and they came from a place where the pandemic is very rampant. They were placed on a 4-day quarantine period at their home, unmonitored by persons from the Ministry of Health. I know in my case, no one from the Ministry of Health ever contacted me during or after the 14-day period that I stayed home to ensure that I would not affect anyone. No one called from the Ministry of Health to find out if I died or if I infected 10 people or whatever the case is. Now, that was my experience. Now, based on what the attorney is saying from the reporter of the news clip that is reporting to the people of Grenada, the doctor who entered our borders here in Grenada was tested for COVID and allowed to go home and self quarantine with his wife. After the 4-day period, or almost at the ending of the 4-day period, the doctor contacted the Ministry of Health and asked the question, what is the result of that test? It is said in the news clip that the doctor was given a picture of a negative COVID test, which I am sure was presented by persons from the Ministry of Health Grenada. Now, with that being said, the Ministry of Health presented a negative COVID test, and a few hours after, the doctor and his wife were able to go and patronize local bars at the south of the island, according to reports from different media stations. 4 to be exact, 4 local bars. The doctor was then contacted by the same Ministry of Health who hours before told the doctor that he was negative. Himself and his wife were negative for COVID. They then contacted them and informed them that there was an error and they were actually positive for COVID. In my humble opinion, the doctor and his wife acted on the instructions of the Ministry of Health Grenada. But what happened after will only shock one's conscience, as the doctor and his wife were charged for violating the laws which stipulate that they should have been quarantined for a certain period, especially as they were COVID positive. Now, upon receiving information from the Grenada Ministry of Health saying that they were cleared and they tested negative for COVID, who would not do the same if they were told that they were negative for the test? Now, what we also heard on that news clip is that the doctor and his wife attended court earlier today. They went to the magistrate's court, and the state of Grenada took no responsibility for the misrepresentation of information that was presented to the doctor and his wife who quarantined themselves at home. This disturbance remains a total tragedy to the people of Grenada, to the public service officers, and every other strand of democracy and preparedness against this disease. The government and the state did not take any responsibility, but instead, what they chose to do was to pursue the charges against the two unsuspecting individuals who accepted the results from the official body, the Ministry of Health. Upon going to court, the doctor and his wife were each charged $5,000 for breaching the Quarantine Act. They were both charged $5,000. And according to the news clip, it is said that the magistrate, Teddy St. Louis, set a precedent of fining these two individuals, to allow other persons to be aware that if they were to breach the Quarantine Act, that they would also face the law. They would also be brought to court and face the law. Now, that is rather unfair and unfortunate, in my humble opinion, because the individuals acted upon the instructions of the Ministry of Health. What we did not hear, or what we expected to hear in that news clip or in an official government statement, is that the persons who presented the wrong information to the individuals, they would have faced some kind of repercussions, maybe a suspension or a fine, or be dismissed from the work, especially seeing that the pandemic that we now face in 2020, that we have been facing since around 2019, the world has been facing since around 2019, should not be based on the incompetence of a few persons within our Ministry of Health who continue, as a matter of fact, to endanger the lives of all Grenadians and persons who are on this Grenadian soil. So we did not hear that in the news clip. So to me, the government has taken no responsibility. They have taken no action to correct this wrongdoing on the part of the Ministry of Health. Just a few weeks ago, we have heard of the situation that took place in St. Patrick's, I believe, somewhere to the northern side of the island, where a young man breached that same Quarantine Act and was said to leave the quarantine facility unknowing to officials at the Ministry of Health. We have also heard claims from the young man that he was informed that he was negative for that COVID vaccine, that COVID pandemic, and that is why he left, by persons from the Ministry of Health. Now, is this a pattern? Is this a pattern of incompetence that has been ongoing for the last couple of decades, where persons who are responsible for public health continue to misrepresent information? They continue to endanger the lives of individuals and every person who lives here in Grenada or who visits here in Grenada. Is it fair for the doctor and his wife to be charged for information that they were given by the Ministry of Health? Shouldn't the persons in the Ministry of Health be sanctioned? Shouldn't they be brought to court as well? Shouldn't they be facing the Public Service Commission at this time for not doing their jobs properly? And without us doing that, without us calling on the government for that to happen, I can guarantee the people of Grenada, Carriacou, and PT Martinique that these inconsistencies will continue to occur over and over and over, and all our lives will be endangered. It is rather unfair that after taking official information from a governmental body, such as the Ministry of Health, that persons would be charged and would have to pay $5,000 each on the spot. What is going to happen next? What is our government going to do next to unsuspecting persons who are taking the advice of officials from the government of Grenada? Ingram, how do you feel about this situation? I know in my position, if that was the case, and I was informed by persons from the Ministry of Health that I was COVID free, and I left according to their instructions, I would not pay 1 red cent to any state organization. How do you feel about this, Ingram?
No worries. Sorry about that. Let me get myself back on screen. So, first of all, I was expecting to hear some form of apology from the Ministry of Health to say, hey, you know what? We didn't get this right. And we wish to give an apology to what's happened. Instead, what we're getting is the Ministry of Health exposing themselves. And if I were a Grenadian, I'd be particularly concerned about any test that I've had previously with them. Because if I've been COVID tested by the Ministry of Health and they've said I'm negative, what's the chances of me being done as positive? And those people who've been done as positive, what's the possibility of those people being negative? And then how can the public have any trust in the Ministry of Health when they've clearly messed up here, but are so arrogant not to be able to say we got it wrong?
And you're correct. You know, we did have a case earlier this year where a positive case of COVID was able to travel from Grenada to Canada, I believe, or on Air Canada to a next country, where he exposed many persons, including airport staff. We're talking about check-in agents, we're talking about baggage agents, we're talking about security officers, immigration officers, customs officers, persons in the duty-free shops, persons who would have driven the gentleman to the airport. These persons were exposed to the COVID pandemic due to more negligence on the part of the Ministry of Health again. And we are now in November, and this is what is happening here in Grenada, and we're not hearing any apologies. We're not hearing about any corrective measures. We're not hearing about persons in these prestigious institutions and positions about how they are going to be disciplined. What is really happening in Grenada is a tragedy. It is an embarrassment to the people of Grenada. It is an embarrassment to public health. It is an embarrassment to our health sector. And what I will recommend is that persons from the Public Service Commission need to find out who this person or persons is or are, and get these persons out of the Ministry of Health. How does one justify mixing up or misrepresenting the results of a COVID test and putting a whole nation at risk. We are speaking about a doctor and his wife who were able to leave their home on the instructions of the Ministry of Health, patronize 4 bars at the south of the island. And we are speaking about after the contract tracing being done, we were told that only 80 persons thereabout were placed and monitored in quarantine facilities, and most likely those 80 persons would have been posted at their homes. So what is really happening? When are we actually going to take a stand against this type of incompetence? I am sure that the persons in the Ministry of Health are being paid by taxpayers' dollars and not producing the services that are expected.
One thing that came to mind, almost as an afterthought, was that potentially the judge that made that ruling that wanted to be unprecedented was thinking to himself, look at all these foreigners coming into the country, people are talking the fact that we're not treating Grenadians the same as we're treating foreigners. So I gotta make myself famous. I gotta make a stand. I gotta show Grenadians that we're not gonna let foreigners get away with it. So this is what I'm gonna do. But unfortunately, he's done it with foreigners who actually they have not got it wrong, but it's his own ministry that's let him down.
Mm-hmm. And it seems to me, Ingram, that the according to the news clip, the reporter is saying that um, the magistrate fined the 2 individuals $5,000 each, because he wanted to set a precedent. Now, the only precedent that could be set from such a situation is that the people of Grenada or persons who are coming into Grenada would have to pay for the incompetence of people who are in the public service. Now, let us look at the law for what it is. Now, in certain situations, upon hearing the justification of reasons for actions and so forth, if someone was to take a life in self-defense, then that would not be considered murder, according to the Constitution of Grenada, Chapter 1, Section 2 of the Grenada Constitution. If one was to take a life whilst trying to bring a prisoner into custody or in the defense of a next person from violence and so forth, that person would not be charged for murder. Now, upon listening to the information that the news is saying that Ali Gill, the attorney for the 2 individuals, presented, which was basically their actions was a result of the incompetence of persons in the Ministry of Health. How could a judge listen to that and actually charge 2 individuals, 2 unsuspecting individuals who acted on the instructions of persons from the Ministry of Health? Now, what is going to happen? You asked the question, Ingram, earlier. Persons should be mindful that other tests, previous tests that have been done for the COVID virus, persons at this point in time cannot be certain if they are actually negative. And I would like to tell each person that would have taken a test that believe that they would have been exposed, that they should go back to be retested, because there is a pattern of incompetence in the Ministry of Health, which means that the results could have been mixed up prior to this case. And I do know that it is not unique to this case. It could happen. It happened once, it happened twice, it could happen again. So I would like to ask persons to go back and try to get the test again to ensure whether they are positive or negative. Please quarantine yourselves just to ensure that there was no mix-up as what has happened with these 2 individuals who came here to Grenada. It is rather embarrassing. It is a public health risk. It is incompetence, and persons should be aware that this is what is happening. Right? Ingram? Ingram?
Totally agree with you. Totally agree. Totally agree.
Right? So this is where we are, and the Grenadian public needs to be aware. The people who are traveling to Grenada need to be aware, and what we're asking people, although the ministry is saying the quarantine period should be 4 days at this point in time, I do believe that persons should try to find such facilities that would be carrying out independent tests, just to reinsure or to ensure that the information provided by the ministry is actually accurate, so they would not end up being fined after acting on the instructions of the Grenada Ministry of Health. Um, I would also like to ask persons to be aware that this pandemic is real. It has taken many lives around the world. Grenada is not an immaculate nation that is the only nation that faces the glory of the Most High, where this virus would not be able to spread. We have seen official correspondence from the Ministry of Health that those two individuals who acted upon the instructions of the Ministry of Health, they in fact caused other persons to become infected. Now we need to be mindful to wear a mask, wash our hands, practice all the protocols that have been established over the time. We have not completed the period where this virus, this pandemic has ended. We have not completed that. Um, these are my final words. These are my final words.
Oh, question. A couple of questions I want to ask. The after this has happened, the doctor that was there to try and open up that women's clinic, is he going to still have the same heart to want to open the clinic up after being done so wrong by the Ministry of Health? One, and two, if they were to take a legal challenge to the Ministry of Health because of our systems that don't seem to work, what would happen? And what routes could they take to take legal action? And would they take legal action?
What I would hope, Ingram, is that the doctor who has been planning on opening this medical center right here in Grenada, that same individual who was just fined hours ago by the Grenadian Magistrate's Court, I would hope that that gentleman and his wife would recognize the inconsistencies, the inefficiencies, and the negligence of the people in the Ministry of Health, and notice that the people of Grenada really do need some proper professionals in our public health system. I do hope that he sees it like that, and that he would continue and come to set up.
If the Ministry of Health can't get it right for this and punish them, what sort of message are we sending on a global message? What sort of global message are we sending to the world about Grenada and about our policies, our Ministry of Health, and how we treat professionals? That it's not good.
Well, it is not. We have been sending some of the worst messages to the public, to the international communities, that we are unable to handle the public health sector right here in Grenada. We look at it at how we treat our dialysis patients, and the fact that there is a significant absence of dialysis machines at the General Hospital, even though Nicola Steele, the Minister of Health, would have announced that at the middle of February this year, 2020, 5 mobile dialysis units would have been placed in the General Hospital. To date, November 26, 2020, months after possibly 10 months after the date was given to put these dialysis machines in the general hospital, they are still not there. This has not been the first mishap. Um, the international communities, including the WHO, based on my understanding, would have made many recommendations previously about the location of the general hospital and ways that the general hospital would have been sufficient enough to deal with the health crisis that we face here in Grenada. But it has not been accepted. It has not been honored by the persons in authority. I am sure that persons in the international communities, after dealing with such horrific tragedies, such incompetence, they would have expected such incompetence over the period. I don't believe that anybody would be shocked at what has happened. We are all aware of what is happening. But what I am saying to the people is that we need to put things in place, that we need to call on those in authority to end this incompetence for persons who continue to collect handsome salaries from the pockets of the taxpayers
I
and
think
not provide that service.
you'll need to make a public apology on behalf of the Ministry of Health for the incompetence, and don't say it's a reflection of Grenadians, but just a reflection of some very incompetent individuals.
Agreed. 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 You know,
How does it, how does this affect Grenada's relationship with America in terms of professionals potentially coming to work in Grenada in the future?
well, my brother, what I can see is that there would be many more limitations. If I was one of those medical professionals that wanted to return, I would look at it from the point of view that my services were necessary, that I would have to come to Grenada to make the changes. But we are aware that persons think differently, and many persons would not want to come to Grenada to have to depend on the Ministry of Health here in Grenada if, in fact, that there is some type of urgency for some kind of surgery or something like that. They would not want to come here and be infected due to the incompetence of persons who actually work in the Ministry of Health, as we
I
have
know that
seen over the past few months.
I know when I was on the island that if there was any emergencies, that Grenada couldn't do the fly to Trinidad. Is that still the case?
Could you repeat that, please?
I said that I know when I was on the island that if there was any medical emergencies that Grenada couldn't deal with, you'd get flown to Trinidad. Is that still the case?
That you would not be able to be flown, or that you would be
No,
flown?
you would be flown to Trinidad.
Would
You'd have to fly to Trinidad.
no, no, you would not. Unless you're a government official, unless you have the finances, the personal finances, you would not be flown to anywhere. You would actually, in many cases, I'll tell you what happens, and what has happened. In many cases where persons need surgeries, persons would actually have to do motorcades, or go on the streets and beg and do raffles and so on, fundraisers to get the funding to go elsewhere to get the surgeries done because they are not offered here in Grenada. Now, that is what has happened. That is what is happening at this present time. And many persons have to now depend on getting finances to try to join one of the local insurance companies. For instance, there's Massey. The government has nothing in place. If you go to the hospital and they are unable to do a surgery, a life-saving surgery, mind you, what happens is they would basically leave you there until you can come up with the finances, or ask you to go home until you could come up with the finances. Right? So the government of Grenada makes no arrangements for anyone who needs
So,
life-saving
so,
surgery.
so it's kind of like America.
Pardon?
So it's kind of like America.
Well, America offers many more surgeries than we do here in Grenada. For instance, persons with kidney failure here in Grenada, there's no surgeries done for persons who need those types of surgeries. There's no surgeries for persons in Grenada who need kidney transplants and so on. Even some of the simplest surgeries, they cannot.
Oh, I think we've lost Mr. Kutain there. Well, that's it from Grenada Matters. Thank you all so much for tuning in. Shocking times in Grenada, shocking times. Catch us next week, Monday, 6 p.m. I think Earl's back. Is he back? There, he's back. He's back. I was just ending the show.
My
back.
apologies. Yeah, my apologies. So many of the surgeries that one would expect to be done at a general hospital in 2020, they are not offered here in Grenada. Many Grenadians have to travel abroad to America, to Barbados, to Trinidad to get surgeries done. There's one young lady who fell, damaged her back, and she is currently trying to raise funds to be able to fly and go elsewhere to Barbados to get her surgery done. Sometime last year, there was a next young lady who fell on her steps while she was trying to hang out some clothes on a normal day, as she would normally do, and she actually broke a bone behind the neck, and she was unable to do the surgery here in Grenada. Fortunately enough, I was able to make the necessary arrangements for her to go to Cuba to get the surgery done. And I will add again that the government made no arrangements to assist her or persons like her in that situation. It is really frustrating. It is horrifying. It is terrible. It is a very, very big disgrace to the public system, the public health system here in Grenada.
Okay, thank you so much for the report and the information.
You're welcome, Ingram. You're welcome anytime. And thank you for taking your time off to alert the people of Grenada as to what is happening in Grenada.
These are very, very uncertain times in Grenada for sure.
Definitely. Definitely.
Thanks again.